Medical information. Claravis. Isotretinoin capsules, USP. Each capsule contains 40 milligrams. Isotretinoin, USP, prescription, blister pack. 10 capsules, PX only. Patient, read information carefully. Causes birth defects. Do not get pregnant. Pharmacist, dispense enact. 40 milligrams. This area is for prescription label. Important information for all patients. It is important for your health that you read all the information you received with this prescription and from your doctor. This package provides reminders of important safety facts about Claravis, but it does not contain all the information you need to know. It is important for you to know how to take Claravis correctly and what side effects to watch for. Read all the information you get about Claravis from your doctor and pharmacist, including the medication guide provided with this package. You should read, understand, and sign a patient information/informed consent form before you take Claravis. Contact your doctor if you have not signed this form. Male patients and female patients who cannot get pregnant must sign one form, and female patients who can get pregnant must sign 2 forms. Never share Claravis because it can cause serious side effects, including severe birth defects. Before you start taking Claravis, tell your doctor if you are currently taking an oral or injected corticosteroid or an anticonvulsant seizure medication. Take part in sports where you are more likely to break a bone. Have mental problems, anorexia nervosa, a type of eating disorder, back pain, and a history of problems with healing of bone fractures or problems with bone metabolism. Claravis causes serious birth defects. Do not take Claravis if you are pregnant. It is very important for you to read and understand the information about preventing pregnancy found in this package, the medication guide, and the materials given to you by your doctor. It is very important for you to interact with the iPledge system to answer questions about program requirements and view the DVD at your doctor's office. If you do not have the medication guide and the patient booklets about pregnancy prevention, do not take Claravis. Call your doctor. Most people have further questions about reading so much important information about pregnancy prevention and birth defects. If there is anything you are not sure about, do not take Claravis until your questions have been answered by your doctor. Store at 20 degrees to 25 degrees Celsius, 68 degrees to 77 degrees Fahrenheit. C. USP controlled room temperature. Protect from light. Mental problems and suicide. Some patients have become depressed or developed other serious mental problems while they were taking isotretinoin or shortly after stopping isotretinoin. Some patients taking isotretinoin have thoughts of ending their own lives, suicidal thoughts. Some people have tried to end their own lives, attempted suicide, and some people have ended their own lives, committed suicide. There have been reports of patients on isotretinoin becoming aggressive or violent. No one knows if isotretinoin caused these problems or behaviors, or if they would have happened even if the person did not take isotretinoin. Stop taking Claravis and call your doctor right away if you or a family member notice that you have any of the following signs and symptoms of depression or psychosis. Start to feel sad or have crying spells, lose interest in activities you once enjoyed, sleep too much or have trouble sleeping, become more irritable, angry, or aggressive than usual. For example, temper outbursts, thoughts of violence, have a change in your appetite or body weight, have trouble concentrating, withdraw from your friends or family, feel like you have no energy, have feelings of worthlessness or guilt, start having thoughts about hurting yourself or taking your own life, suicidal thoughts, start acting on dangerous impulses, start seeing or hearing things that are not real. Tell your doctor if you or someone in your family has ever had a mental illness, or if you take any medicines for a mental illness, for example, depression. Other serious side effects to watch for. Stop taking Claravis and call your doctor if you develop any of the problems on this list or any other unusual or severe problems. If not treated, they could lead to serious health problems. Serious permanent problems do not happen often. Headaches, nausea, vomiting, blurred vision, increased brain pressure, severe stomach pain, diarrhea, rectal bleeding or trouble swallowing, yellowing of your skin or eyes or dark urine, changes in hearing, allergic reactions, bone or muscle pain, vision changes, including trouble seeing at night. This can start suddenly, so be very careful when driving or operating any vehicle at night. Persistent fever, chills, or sore throat. Other information is found in the medication guide in the booklets from your doctor. Common side effects that are not serious, but you should tell your doctor about. How to take Claravis. Things to avoid during Claravis treatment. Ways to get more information if you need it. Warning to female patients. Claravis may cause severe birth defects. Warning to female patients. Do not get pregnant. Note, protect capsules from light. Please keep this package intact to protect important information that you need to know about Claravis. You must not take Claravis if you are pregnant or may become pregnant during treatment. Number 1, directions for removing each Claravis capsule. Please foil tab at arrow, not capsule. Turn card over to peel back protective paper. Backing from other side. See illustration. Do not push capsule to remove. Proceed to step 2. Step 2. Directions for removing each Claravis capsule. Peel off the protective paper backing. Grasp paper / foil tab in the direction of the arrow to free each capsule. Claravis causes severe birth defects. Highlight of warning to female patients. It is important to watch the DVD and read all information and materials given to you by your doctor. You must not take Claravis if you are pregnant, because any amount can cause severe birth defects, even if taken for short periods during pregnancy. You must not become pregnant 1 month before, during, and for 1 month after you stop taking Claravis. You will not get your first prescription for Claravis until there is proof you have had 2 negative pregnancy tests and instructed by your doctor. A negative test means that it does not show pregnancy, and you have interacted with the iPledge system to answer questions about program requirements. You cannot get monthly refills for Claravis unless there is proof that you have had a negative pregnancy test conducted in a lab every month during Claravis treatment. Even the best methods of birth control can fail. Therefore, 2 separate effective forms of birth control must be used at the same time for at least 1 month before, during, and 1 month after you stop taking Claravis. Stop taking Claravis right away and call your doctor immediately if you have sex without birth control. Miss your period or you think you are pregnant while you are taking Claravis. If you think you are pregnant in this month after you have stopped Claravis treatment, call your doctor immediately. Very severe birth defects have occurred with isotretinoin in use, including severe internal defects that you cannot see, involving the brain, including lower IQ scores, heart, glands, and nervous systems. Thymus gland abnormality, ear abnormalities, parathyroid hormone deficiency, cardiovascular abnormalities, severe external defects that you can see, such as low set, deformed, or absent ears, wide set eyes, depressed bridge or nose, enlarged head, and small chin.